name is Jesse Herrera. This is for my Kinesiology 552 class. This week we'll be doing our flexibility assessing and testing. We're going to test the flexion of 5 joints today. We're going to measure those with our goniometer. This is my client, Lauren Herrera. Today we'll be measuring her shoulder flexion, her elbow flexion, her hip flexion, her knee flexion, and her ankle flexion. So first we're going to start off with the shoulder joint. The key here is we have our goniometer. The middle point here is called the fulcrum. You can see this is our stationary arm. This is our arm that's going to move, give us our degrees to show us what the flexion is. So for the shoulder joint, she's going to be lying in the supine position. She's going to go ahead and extend her arm back as far as she can, and then we're going to measure from there. First, we need to find, for the shoulder, the acronym process, which is, see, we're going to find that right here with the top on the shoulder joint. You have to have Lauren go ahead and extend her arm back. You can see that's right here. So we're going to place that right there. With our stationary arm, we're going to go ahead and put that with the midline of the thorax. Hold that with 2 fingers. Now the moving arm, we're going to go ahead and put that with the lateral epicondyle to get our number. So right there we have a reading of 1, it's kind of hard to see, 170. We'll go ahead and write that down. And this is for the right side, and that's our shoulder. Next joint we'll be measuring is the elbow joint. We went ahead and placed a little towel underneath here so we could, that way the goniometer is not kind of smashed on the floor. It gives a little more parallel measuring plane here. So we're going to go ahead and place the fulcrum on the, we're going to find the lateral epicondyle of the humerus, which for the elbow is right here. We're going to go ahead and line our stationary up with the acromion process. And our arm is going to be lined up with the radial styloid process. So go ahead and bend your elbow up as much as you can without forcing it. You want it to be passive flexion. Now we line that up right here. We're going to go ahead and get a measurement. 137 degrees. And that's for the right elbow. Now we're going to move on to the hip joint. We have our patient laying in the supine position again. Go ahead and drop both your legs there. Let's go ahead and put our right arm across your stomach here. So that way it's not in the way of the hip coming up. Let's do a practice run here. Go ahead and lift your hip. Your toe pointed down. Bend your knee. We just want to make sure the hip doesn't touch the arm. So for the fulcrum, we're going to go ahead and find the greater trochanter, which is right under the hip joint. Bend a little bit. Probably see a little better if you bend right in here. Okay, so we're going to put that there. We're going to go ahead and have our stationary arm set up with the midline of the pelvis. Now our client's going to go ahead and bend her hip joint up as high as possible. We're going to line this up with the midline of the femur. So we have a 90 degrees. And that's our hip. Now we'll be measuring the knee joint. Same thing will be on the right side here. First thing we're going to do is find the fulcrum, which for the knee is going to be the epicondyle of the femur. We're going to go ahead and line that up. Right about here. Now, we're going to go ahead and make this a little easier. We're going to have our client. What you're going to do, Lauren, is you're going to slide your foot back, leave it on the floor as high as you can. Go as far back as you can. Keeping your foot on the floor. So we'll go ahead and measure right There, we can go ahead and put that fulcrum right epicondyle of the femur. We're going to have our stationary set with a greater trochanter of the femur. And then for our arm, we're going to go ahead and move that, adjust to the lateral malleolus of the fibula. So this gives us a degree measure of 121, and that's our knee joint. So our fifth and final joint we're going to measure here is the ankle joint. We're going to go ahead and measure twice. We're going to have what's called dorsiflexion, which is the ankle moving up, and plantar flexion, which is the ankle moving the downward motion. So we have our client sitting up here, that way we have the leg hanging here so she can get a good range of motion with her ankle. So the first thing we're going to do is find the fulcrum and put that on the lateral malleosus, which is right. If you find that little ankle bone, it's going to be right here in the front part of it. So we're going to go ahead and put our fulcrum right there. We're going to line up our stationary piece with the fibula head. And Lauren, you're going to go ahead and in the dorsiflexion, you're going to go ahead and flex your foot up, ankle as high as you can. We're going to keep this arm parallel with the fifth metatarsal. So right there is going to give us a 91 degrees for the dorsiflexion. Go ahead and put it back. We're going to find that same lateral malleosus. Keep this straight. Now go ahead and have your foot go down for the plantar flexion. And make this parallel again with the fifth metatarsal. And that's going to give us a 170 degrees for the plantar. And that's our ankle. Now we're moving on to the sit and reach test. So the first thing we do is we have to set up the YMCA sit and reach style. So we went ahead and put our yardstick here. If you can extend your feet back for a second, you can see we have it's a clear tape marked at the 15-inch line. So I went and put a little red marker so it could be easier for our client Lauren to see. You're gonna go ahead, Lauren, and line up the heels right at the edge there. We're gonna have these about 10 to 12 inches apart. So right about there. Bring this one back just a little. So with sit and reach, we're testing our flexibility here. You're gonna go ahead, she's gonna go ahead and reach forward slowly. You're going to have both hands one over another. You're going to reach down to the yardstick as far as you can. Go ahead and touch as far as you can. So you can go ahead and do it one time. That's about 8.5 inches. Okay, go ahead. You feel a little loose still? Okay, we'll go ahead and do it again for our second time. Reach as far as you can. That was a little better, 9.5 inches. And that concludes our sit and reach test. Okay, now we're going to start with our second side, the other side of our joints. We're now turned our client around Lauren. We're going to be measuring the left side of her joints. So we're going to start with the shoulder. Again, we're going to find the acromion process, which is that bone right here on the shoulder. Go ahead and extend your arms upwards here, Lauren. So that sticks right here. So we're going to put our fulcrum right there. And then line our stationary arm up, midline of the thorax. We're going to go ahead, line this up with the lateral epicondyle to get our reading of 175 degrees. And that's our left shoulder joint. Okay, now we're measuring our client's left elbow flexion. So again, we start off finding that lateral epicondyle of the humerus for the elbow. We're going to place our fulcrum right there. We're going to line our stationary arm with the acromion process. Then we're going to line the regular arm when she bends up. Go ahead and turn your arm, bend it up passively. Put that with the radiostyloid process. And that gives us an angle of 135 degrees for the elbow, left elbow. Okay, so now we move on to our left hip. We're going to measure the flexion degrees here. We're going to start with the fulcrum again, finding our greater trochanter. The hip, right. Go ahead and bend up a little bit to help me find it there, right here. So we're going to go ahead and place our goniometer there. The fulcrum goes right on that spot. We're going to go ahead and line the stationary part up. Lateral with the pelvis, the midline. And go ahead and pull your hip up as high as you can. And we're going to go ahead and line the moving arm with the lateral midline of the femur. Pretty good. That's going to give us an angle of 92. And that's our hip. Okay, for our next joint, we're going to have our left side of our knee. Again, our client is in the supine position. She'll be sliding her leg up. You'll practice one here. Sliding her heel on the floor high up as she can. And you go ahead and put it back down. We'll get ready to measure with our goniometer. So go ahead and pull that up. We're going to find the fulcrum so we can place it on the epicondyle of the femur. So go ahead and pull that one up. It's a little easier when it's up. Place that right here. Our stationary piece is going to be midline of the greater trochanter of the femur. Hold that right there. And then our arm is going to be the lateral malleosus, the malleolus of the fibula. So for our left knee, we have 118 degrees. And that's our left knee. Okay, our last measurement here is going to be for the ankle again. We're doing the left side, so we move our client around. Again, we're going to find the lateral malleosus, the lateral malleus of the left ankle, which is going to be right here in front of that joint. So we're going to line a fulcrum up with that. We're going to go ahead and put our stationary piece with the midline of the fibula. Go ahead and extend upwards. That's going to be our dorsiflexion. We're going to make this level with the fifth metatarsal. It's going to give us a (108) for the dorsiflexion of the left ankle. And we're going to go ahead and do the plantar flexion. We're going to go ahead and find that same spot again, the malleolus. Line our stationary head up, midline of the fibula. Now go ahead and extend that down as far as you can. And make this parallel with the fifth metatarsal. There we go. And we're 171 degrees for the left plantar flexion. So that concludes all of our tests today. We've done our 5 joints: the shoulder, elbow, hip, knee, ankles. We did the sit and reach test twice with our goniometer. And now we'll go ahead and start looking over some of our data and compare some notes and see where we can improve flexion and different joints maybe that we can do. Thank you for watching.